If you live to get to the roof, 97% of the time you survive to get out of the hospital.
Award-winning surgical care and cutting-edge innovative research.
Discoveries, innovations, and extraordinary clinical care.
We teach future pediatric specialists our unique approach to compassionate patient and family-centered care.
We take our mission seriously. The expertise in the Department of Radiation Oncology makes us a destination for patients from all over the world.
I've been blessed to be part of the University of Maryland Medical Center and the School of Medicine for my entire professional career. That career has spanned now over 20 years. And while a majority of that time I've been part of the world-class cancer program that exists here at the University of Maryland, I now have the opportunity to sit in a seat that allows me a vantage point to see all of the amazing clinical care that goes on throughout this organization.
Thank you. All right.
Got sick in July of 2012, had a tumor removed from my bladder, did well for 2 years, and then had a recurrence that the cancer metastasized into the lymph nodes.
One doctor told us, with nothing, 6 months with chemotherapy, you may live a little over a year. And we opted not to do chemotherapy.
At one point, they told me to go home and get my affairs in order.
There's a lot to be proud of our Department of Radiation Oncology. Beyond having the most advanced technologies and tools to fight cancer, just as important as we have the experts who know how to use those tools in the care of patients.
It was a wonderful treatment, in my opinion, and we had the best doctor to do it.
I absolutely have. Had a second chance at life.
I had bacterial endocarditis in 1985. I had a mitral valve replacement in 1988, but my heart was becoming larger and larger.
When we met Dr. Feller, she said, you know, I would really like to get you into the hospital. She could see how sick he was. And she put him in the hospital the next day.
My wife was told that I had maybe 1 or 2 months to live.
Erica came into the room and she said, I have a surprise for you. Just, we have a heart. Do you want it? And he said, yes. So, still very emotional.
She had contacted the Living Legacy Foundation, indicating she wanted to meet with me if we were willing to meet with her. Of course we were. She said that if she could, she and her mother would like to listen to her son's heart. Same relationship, same reaction that I had now then, and I have it now, and that's how we met. You can't thank her enough.
We're lucky at the University of Maryland because patients come to us from all over the United States for their transplants. And that we've grown to be one of the largest transplant programs because of our willingness to take on complex cases that can't be solved at any other transplant center in the United States. It really is a joy to have our center be a destination program for the country.
So the whole thing's been a miracle to us. Let us really enjoy our lives again.
UMMC to City 17.
The Shock Trauma Center is the only freestanding trauma hospital in the United States, one of the few in the world. It delivers more trauma care than any other institution in the U.S. and certainly is one of the leading centers in the world.
I've been involved with the Shock Trauma Center for 23 years at the University of Maryland. I never thought that I would be a patient in shock trauma.
Yes.
What we take care of is unscheduled tragedy. Nobody plans to come here, but 8,000 times a year it happens.
I had a horse accident that day, and I had a hematoma in my brain, 3 broken ribs and lacerations in my head. They got the helicopter to come and collect me, and they took me to shock trauma, and I spent 4.5 days there. Right after that, 10 days later, I had the stroke.
Devastating neurologic situation. To say it was touch and go would be a fair statement.
When I got there, I was dead when I arrived at shock trauma, and he got me breathing again on the elevator.
It was another example, I think, of superbly orchestrated care where, once again, it was only about the patient.
If I had gone to another hospital other than shock trauma, I probably wouldn't be alive.
Nick was one of the most caring people that you could ever meet.
He certainly loved sports, especially baseball. He loved hunting.
When Nick took sick, we had no idea that anything was really going on. When we took Nick up to University of Maryland, they told us it was leukemia. They told us he would be there 6 to 9 months, would not get home much, maybe a day or two here or there, and that there was like a 60% success rate in it.
Care was fantastic. The nurses took care of them better than anything you can imagine. They, it's like family.
When he first was diagnosed, some people would call and say, well, have you checked this place out or checked that place out? And I said, I'm not checking any place else. I said, this is where he needs to be, because they were the most loving and caring group of doctors and nurses that you could ever ask for. When we lost Nick, we knew right away, and we wanted to start a foundation.
Even though we lost our son, the experience at the hospital with the people involved and the care that we got and seeing the needs, we're just happy to be able to contribute what we can.
It's kind of him, never gave up, fought.
We look at it as their way of Nick touching other people, even though he's no longer here.
No doubt in my mind that I want to give back, because Dr. Vajeklovic saved my life. I'm interested in hypothermia, and if I ever need it again, it would be available. And I think that it's also a program that many other patients could benefit from. We will be
the first in the country to have a deep regional thermal therapy unit, but more important, we have an internationally recognized expert in Dr. Željko Vajošković in using that thermal therapy and providing new hope for cancer patients. The Howells have now made a big difference for not only our department, but more importantly, they're making a difference for cancer patients around the world.
It makes us feel so blessed to have the opportunity to contribute to such a wonderful cause. We know it's going to make a big difference in curing cancer.
The power of partnership is really what makes the University of Maryland as strong as it is. And we have partnerships between the clinical programs. But another part of the partnership is our partnership with our donors, the people who support our research programs and make us able to recruit the best and the brightest surgeons from around the country and even around the world. I'm tremendously grateful for the gifts that we receive to the Department of Surgery. It makes an incredible difference.
We just feel so strongly that the lung and heart transplant area has helped so many people, and in any small way that we can, we want to help them.
I get to do something that maybe 0.1% of the people in the world get to do. I get to heal, and I get to see people who were supposed to be dead go home and be pretty good, or be very good.
Shock trauma saved my life on 2 occasions, the horse accident and the stroke. I would never want to go to any place else.
It's very clear in 2016, no money, no mission. The ability to do those things has allowed us to get even better. It's allowed us to really expand the mission to innovative programs like the lung rescue unit, like the critical care resuscitation unit, stuff nobody else in the country has.
Here at the University of Maryland, we are national leaders in the healthcare conversations that are going on throughout this country. And when we consider the patients that we care for, we certainly are very proud of the role that we play in delivering healthcare to the state of Maryland. And when patients come to us, whether it's from around the corner in West Baltimore or around the world, our focus is on the patient and their families to ensure that they have the finest healthcare experience in our organization.